Dr. Anani, it's
Yes,
really
Dr. Mitch.
striking what the differences are, even though the disease is the same. As
Yes,
in the United States, the children are by and large nutritionally sound. They recover in 3 or 4 days. My grandchildren who were had COVID-19 were going down a water slide, but the parents were exhausted with COVID-19 trying to watch them. And so they recover because they're nutritionally sound. Our children in Haiti face a much greater problem with malnutrition being a comorbidity. How do we do this?
That is true, and sorry that your family had to experience this hard disease. In fact, there was some pre-existing conditions, and those pre-existing conditions was malnutrition, that the kids become immunocompromised. So even before the COVID-19, they were weak. So when we understand that, we say we cannot let the kids to have COVID-19 since they have been already malnourished. So what we did with the support of our donors, the team in the US, we say, okay, let's protect those kids. We start by providing more education, more outreach activities. Then we realize, actually, to protect those children, we have to shield the entire family, meaning that we have to provide to those households chlorine for potable water, hand washing
Yeah,
station,
because the death
hygiene
rate
kit.
before depended on even if they had moderate malnutrition, if they got a waterborne disease, they died of diarrhea and that. Now, if they get COVID-19, they can die just like they did with the diarrhea and the waterborne diseases
And even faster, unfortunately.
because of high fevers and everything.
Yes, and the COVID-19 is like an amplification of the sign and symptom that was already there. And what we did to complete the shield process, beside the potable water, is to make sure also they have a hand washing station, is to make sure they have masks, not only to protect the children, but to protect themselves. When they go out, they do not bring back the virus in the family.
We've got to make them more fortified and able to combat anything that comes down the pipe. Right now it's COVID-19, but ultimately it can be some other disease.
Yes. This is what we have been doing, I would say, for the past 2 decades, by saving the life of hundreds of kids in Haiti every year. The COVID-19 just reminds us how important it is to maintain those fundamentals, and also to remind to our funders how important it is to have their support, their love, to continue to build the next generations with healthy kids in Haiti.
Our staff and you, although you do wonderful work, could not exist if it weren't for the generosity of our donors in the United States. So it's wonderful, and we ask our donors to double down in a time of crisis and not only take care of their children here, but take care of our children in Haiti.
Thank you.